people with sinus issues, saline rinses or topical steroid sprays can be pretty helpful, but when they stop working, lots of people have trouble breathing, and it can be pretty miserable. In tonight's Health Watch, I'll show you how a local doctor helps his patients take a deep breath again.
Good to see you, Steve.
Good to see you, too.
How's everything?
It's going good.
Steve Stallings is breathing easier these days, literally. After 15 years of struggling to get enough air, he came here to Nevada ENT and Hearing Associates.
Before, I couldn't breathe through my nose at all.
Where fellowship-trained rhinologist Dr. Josh Meyer diagnosed him with chronic sinusitis, which is basically inflammation in the nose.
The lining of the nose is overreacting to normal things.
You can see the trouble Steve had here on his CT scan. Sinuses should appear black.
All of this kind of scattered gray in here, these are the polyps he had.
And as Steve experienced, while it creeps up on people, it really affects their quality of life. Steve also had a deviated septum. So along with fixing that, they decided to do a minimally invasive endoscopic sinus surgery to open up the drainage pathways better.
Using a camera, an HD camera, and a small endoscope, we use my left hand to hold that, and I look in the nose while I'm watching TV on an HD. Basically.
Think of it like a honeycomb. Dr. Meyer removes the partition strategically to preserve the mucous membrane, which he says means quicker healing and no packing. Recovery takes about a week, but within a couple days, Steve already noticed a big difference.
I didn't really realize how bad it was until now I can breathe.
Dr. Meyer says polyps generally do grow back in 5 to 7 years, hence the name chronic sinusitis. But until then, Steve is back out doing what he loves, hitting the trails and enjoying the fresh air.
It's like one of the best runs I've had in 10 years.
Now, Dr. Meyer says when packing is not used, there is minimal pain after nasal surgery. It's a whole lot better. And if you still have questions about this procedure, he'll be my guest on Monday's Ask the Doctor. Call 858-2222 at 5 o'clock. And for a closer look, go to KTVN.com and click on the Health Watch icon.